We will use the concept of mobility for musculoskeletal system. The model on your screen shows the interrelationship of concepts associated with motion. Motion depends on the delivery of oxygenated blood to tissues and coordination of movement regulated by the brain, spinal cord, and peripheral nerves. When pain occurs as a result of movement, mobility can be impaired. Adequate nutrition is needed for mobility, and mobility is needed for adequate preparation of food. Impaired mobility can lead to impairments in elimination as well as skin breakdown and impaired tissue integrity. Whole point is become familiar with those interrelationships because they will impact holistic care of your patient. When going through general health history and problem-based history questions from your textbook, make sure to read over risk factors related to osteoporosis and osteoarthritis. Routine examination should include inspection of skeleton and extremities for alignment and relative symmetry. Further assessment should be done if posture is irregular or if there is any asymmetry or misalignment. Some examples of deviations in curvature of spine are kyphosis is a posterior curvature of the thoracic spine. Lordosis is an anterior curvature of the spine. Scoliosis is the lateral curvature of the spine. When inspecting muscles for symmetry and size, keep in mind that no person has exact side-to-side symmetry. Dominant side is usually slightly larger than the non-dominant side. Using the pads of the thumbs and fingers of both hands, you will palpate the joints for pain and edema and muscles for pain, edema, and tone. When you are assessing temperature, back of the hand is better. Compare side to side. Observe range of motion for major joints and muscles. Ask patient to perform range of motion actively. When we use that term, active range of motion, it just means range of movement through which a patient can actively move a joint using the adjacent muscles. So it will be without any assistance. And when we talk about passive range of motion, this is the amount of motion at a given joint when the joint is moved by someone else. So it's external force. When you move the patient's joints passively through the full range of motion, do not force movement of a joint when it is painful or spastic. You will be testing muscle strength and comparing sides. Testing muscle strength may be performed as part of the musculoskeletal or neurologic system examination. Ask the patient to flex the muscle being evaluated and then to resist when you apply opposing force against it. Muscle strength of lower extremities can be tested by having patient push or pull against your hands. Expect muscle strength to be 5, bilaterally symmetric with full resistance to opposition. Please read tables that go over range of motion for diarthrodial joints and screening tests for muscle strength from your textbook. We will be using them to do activities in the classroom too. When you are examining specific musculoskeletal joints, inspect for conformity, rhythm, symmetry, balance as your patient walks across the room. When assessing the patient for grip strength in upper extremities, you can have the patient grip your first 2 fingers on each hand. The response should be bilaterally equal and the grip tight and full flexion. Some nurses cross their hands for the patient to grip the fingers. So the patient's right hand is gripping the nurse's right hand. This method or maneuver helps the nurse remember on which side the patient may have any deficits or problems. You will be practicing range of motion and muscle strength tests in the lab with each other. So make sure to become familiar with them as you read procedures and techniques from your textbook. Remember, your instructor will be present to help with any concerns during the lab time.